Welcome back to the Painexam podcast. Today, I am happy to be joined by Dr. Sarah Trahan, who is a naturopathic physician at the Neil Riordan Center for Regenerative Medicine at Sonoran University of Health Sciences in Arizona. Welcome.
Hello, thank you for having me.
Before we get into the interview, just a few announcements. We have our monthly ultrasound courses. I didn't schedule another regenerative medicine course yet, but it will be coming up soon. And if you're interested in private training, just reach out to me. And of course, we have board prep, CME workshops, etc. Just go to nrappain.org and you'll get more information. Sarah, welcome to the show and thanks for getting up early and joining us. How are you?
Good, thank you. Yeah, it's mountain time here, so
Right.
it's nice to start the day early. Thank you.
So, we were actually introduced virtually by one of your students. So could you tell us about yourself and what you do, please?
Yeah, of course. So I live and work in Arizona at Sonoran University of Health Sciences. It recently had a name change from Southwest College of Naturopathic Medicine. We've adopted some master's programs, but I work within the clinic at the university called the Neil Riordan Center for Regenerative Medicine, where they host a residency for naturopathic physicians under the guide of a medical doctor, anesthesiologist, as well as naturopathic physicians. There's a dentist that works there, Oriental medicine provider. And so one of my students, David James, was kind enough to introduce us. He's very passionate in the field of regenerative medicine. He spent a lot of time training under myself and colleagues. And so I think one of the reasons he was so excited to introduce us is because, your work in pain management and then how NDs or naturopathic doctors are uniquely positioned to help people in chronic pain.
So I guess the first question I have is when you say naturopathic physician, obviously it's you're not going to be throwing medications, opiates at people, but you do have different methods of treating pain. Some of them I'm sure overlap with ours, but can you like let's say someone comes to you with I don't know sciatica or headaches, how would you approach it, and what would you do differently than your typical MD?
Yeah, great question. So, as naturopathic physicians, we do have a DEA license. We do have the ability to prescribe certain narcotic medications, and we do utilize that when appropriate. So, if you can think about the therapeutic order, and I think allopathic and osteopathic physicians follow this to a large degree, but you meet the patient when they need a high force intervention largely. Whereas maybe we're seeing patients whenever they are establishing the foundation of health, or they're trying to stimulate their own self-healing or restore weakened systems before we need that high force intervention. So we might meet our patients a little earlier in that process. There's maybe less obstacles to get to us versus having to go through maybe the insurance model. But if someone is coming to me for low back pain, sciatica, for example, I can address, from an herbal perspective, what evidence-based medicine do I have that gives turmeric the ability to help you? So really understanding through nutritional classes, learning supplements alongside pharmacology in school, how we can utilize the herb or the natural thing to be helpful. What dose do we need? How do we take it? We learn acupuncture in school. We learn how to use myofascial release using our hands. And so, you know, early on, we have tabs on our patients because we're doing twice weekly acupuncture and maybe turmeric, 1 gram a day, for example. And if we're not seeing the progression that we want, they're in my office often enough that I can switch to another intervention. Like, okay, well, now we might need to try a diagnostic block of your sacroiliac joint, for example.
So you guys do nerve blocks as well.
We can do joint injections and nerve blocks depending on the state and the licensure. So it's state by state in which we are allowed to have a certain scope of practice.
Interesting. And how is your training? Is it 4 years of school or is there residency, internship, etc.?
Yeah, so residency is not mandatory for every physician that graduates, depending on the state, but we have, 4 years of the normal sciences, clinical rotations within the last 2 years of that training. And then I had underwent 2 years of residency followed by internships within the practice.
And you take courses in pharmacology, physiology, so you're prescribing meds. You mentioned you have a DEA number. As far as the interventions go, so I guess, well, before I get into that, so just because you're a naturopath doesn't mean you're a pain doctor. It means you could be also working in OB-GYN or GI or other specialties.
Yeah, and so we only have certain specialties
Okay.
within naturopathic medicine. There's the pediatric, homeopathic, oncology. There's no pain medicine specialty. So largely I'm, a family practitioner, a general practitioner. But my training has led me to focus in pain, if
Right.
that makes
I'm
sense.
I'm smiling because it's like, well, why not? It's kind of intuitive. I mean, when I had my pain, my sciatica, my radiculopathy, etc., I didn't want steroids. I didn't want drugs. I mean, I loaded up on turmeric, um, tried some exercises, and this is what I tell my patients as well. I'm not when they leave my office after their first visit, they look at me like, "Aren't you going to give me something?" I'm like, "Well, I'm not really a big pill pusher. I mean, yeah, if you need something, I'll give you something, but." And I mean, I'm not even pushing the non-opiates. I mean, I'm just trying to give people education.
Yes, and that's largely what we should be doing, right? Docere, doctor.
Right, exactly. And I leave it up to them. I kind of tell them the way I see the problem and what I would do for myself, and then I leave it up to them. If they really think they need a Lyrica or a gabapentin, fine. But I never took that stuff for myself because I just don't want to be taking medications when hopefully I can find a more natural way.
Yeah, absolutely.
So I guess what kind of I think is starting to cause more of a aside from the turmeric and the supplements, but what's kind of making a convergence between the naturopathic world and the allopathic world is the regenerative medicine because you're really, you know, manipulating the body to heal itself. And I think um I mean I'm seeing in my practice more and more patients are coming in educated and they're asking for it. I'm not I
Mm-hmm.
to really educate them as much and teach them as much because a lot of them already know and they understand that it's probably a safer and better way.
Yeah, absolutely. And like you've mentioned before in your podcast, it's the financial barrier oftentimes that just prevents people from even indulging that curiosity.
That's right. And I do feel bad for the patients who can afford it. And unfortunately, the kit I used for my regenerative medicine is a few $100s. So,
Hmm.
they tell me they went to a doctor who did PRP for them and it cost them $100. It's probably a little test tube and it's not enough platelets to do much. I mean, maybe it helps a little bit, but I think people are realizing and they're starting to tell me now, hey, I want the PRP. I'm going to save my money and I'll see you in a few months.
Yeah.
I think
See
that's
it as an investment.
right. They're investing in their health. So I think it's a big mindset shift from how it was even just a year ago or 2 years ago.
Yeah, absolutely. They're taking it into their own hands. And also, too, we can do so much with it before needing the surgery. And it can be such a reactionary thing sometimes whenever you're being worked up with sciatica, maybe spinal instability that's low grade. It might be helped, like you said, with those physical therapy exercises, a little bit of time and education, knowing that you're going to be okay. If you don't know anything, it's scary if this pain is so severe.
Or if you know too much, like I do, it's
Yeah.
terrifying because you see, if you have a radiculopathy, think, am I going to be like this like this patient who I see who never gets better, or
Hmm.
I go for surgery, or who's miserable? So, luckily,
Yeah.
for the most majority of people, this stuff comes and goes. It's not usually permanent, but of course, we deal with the worst case scenario in our practices.
Yeah, absolutely. And you had mentioned kind of the convergence of our fields, and you're probably familiar with Dr. Hackett, the prolotherapy. He kind of brought
I've
prolotherapy
heard
to
the
the
name. I've
forefront.
heard the name. I
Yeah.
don't really do prolotherapy, but believe it or not, I've taught it at courses, but I don't
Yeah.
practice. It was just part of the curriculum. But yeah, I mean that's probably the first regenerative medicine procedure we ever really did.
And his description of it, or at least from my most recent reading of his description of it, is just proliferative therapy. So it includes the PRP,
That's right.
the bone marrow, the dextrose, whatever else. But yeah, if you have to intervene maybe 3 times with the sugar, might as well go in once with the PRP or.
Right, that's the way I see it.
narrow.
As long as, if money's not an issue, which it usually is, but if
Yeah.
if you have an option, I definitely would prefer the PRP. So okay, so do the insurance companies cover naturopathic medicine?
It depends. So, at least in the state of Arizona, our Medicaid system, it's called Access, it covers naturopathic physicians to work as primary care under 18 years old. There's a House bill that's been, I think, through, it's failed being voted on through the legislative season the last two sessions, trying to get to increase that access. But largely, big name insurance companies do cover certain aspects of naturopathic medicine, largely as us functioning as a PCP. They're not going to maybe cover ancillary labs or certain supplements that are purchased over the counter. But it just depends if you've been credentialed through them.
And what interventions are you doing in your practice? Trigger point,
Me personally,
or yeah, well, is it you personally or someone else like an anesthesiologist or something?
so in my practice, we don't charge insurance because we're doing, diagnostic blocks with a little bit of sugar and local anesthetic most of the time, for example. And insurance won't cover the dextrose prolotherapy.
Right, right.
And then moving on to the PRP, et cetera. Yeah, I'm using fluoroscopy and ultrasound guided interventions. So, we've got the whole setup. We have a rad tech. We have the fluoroscopy machine, ultrasound right there, so we can look at not only the joints, but the connective tissue surrounding.
Right. Which you remind me of, a lot of people who treat back pain, um, pain doctors. I mean, I'm in the world of interventional pain, and even me and my colleagues, we're sometimes a little clueless as to, and it's hard to kind of distinguish. Sometimes people have a backache, and we always think muscle, joint, nerve, disc, maybe bone. Very few of us will be able to isolate and identify a ligament. And when we talk
Mm.
about therapy earlier, it makes me think of this. And if you look at I don't have the diagram here, maybe I'll post it in the show notes. If you look at the diagram of ligaments in the lower back, especially connecting the lower back to the sacrum,
Hmm.
you'll see so many ligaments, you could get dizzy, especially the SI joint or the L5 to S1 or to the iliac bone. And any of these ligaments could be inflamed and causing the pain. And most of us will just look at look at the disc, the MRI, and
Hmm.
and assume, oh, L5S1 disc or facet, and it may not be that.
Absolutely. And it's interesting, and I'm sure you've seen this in practice, when you're intervening certain facets, it might feel like a radiculopathy. Maybe you're just causing a chemical, aggravation to the exiting nerve root, but to see those pain patterns when just on a ligament somewhere, you can see how that might inform your history taking and then what to do with the next patient that comes in.
That's right. It's a real funny thing, and I mention this seriously, like to people every freaking day because every there's still a knee-jerk reaction to do an epidural for cervical radiculopathy when they fail conservative therapy. Yet people can get away. 90% of them will respond if you do something less invasive, like
Hmm.
suprascapular nerve block or brachial plexus block outside the foramen. And you don't need to do a cervical epidural. And of course, cervical epidurals work great. They really do. But the
Hmm.
point zero whatever percent of people who get a hematoma, an infection, or a bleed, it's catastrophic. So
Hmm.
whenever I can avoid doing an epidural next to the spinal cord, cervical, thoracic, I do. And I'm telling you, 90% of them will never need the epidural. So I say that because when I had the cervical radic in the neck, I had one of my students give me a PRP injection outside of the foramen and around the facet joint. And
Hmm.
I have a disc herniation and I have a foraminal stenosis, yet that was enough.
Hmm.
And I mean, I'm hoping it will last long, but so far so good. And you kind of people are like, well, it wasn't even in the epidural space. It wasn't even at the disc. I'm like, no, it was lateral and it still works. So I mean, there's still a lot
Yeah,
we can learn. And I
it's a
mean,
great example.
exactly. It's amazing field pain and it's definitely not black and white. It's not clear cut. So that's kind of what I think leaves a little room for creativity in our specialty.
Absolutely. It's straightforward enough to, make you feel confident going in to help somebody, but there's still those nuances what keeps it fun and um, you can be creative with how you can help people, which is wonderful.
So if I guess if I wanted to, or any doctor listening to this pain doctor wanted to hire a naturopathic physician, like how many schools are there in the States? Is it a common thing? I don't know anyone in New York who does this.
Yeah, and New York is, I think, positioned in a way that really, at least the American Medical Association, I think, really fights against expanding the licensure of naturopathic physicians, which makes it difficult. Arizona has been successful for whatever reason, but in North America, at least, there's a school in California called Bastyr. There's one in Washington called Bastyr as well. And then there's National University of Health Sciences in Chicago. National University of Naturopathic Medicine in Portland, Oregon. There's Sonoran University in Phoenix, and then there's two schools in Canada. So not many at all. And like I said, it's state by state in terms of how the boards work and how the licensure is, putting either you in handcuffs or allowing you to work as a primary care like you're trained to.
Right. Amazing. I just received the file you sent me with all the ligaments. That's
Oh
exactly
yeah.
what I'm talking about. And
Mhm.
I'll post this because people really don't realize how many ligaments there are and how oftentimes SI joint pain is really not an arthritis of the joint. It's a ligament issue for the ligaments around the joint. So if you don't get that perfect arthrogram on the C-arm, and if
Mhm.
outside the joint, there's still a good chance the patient will respond. And it's not only the ligaments, you have your lateral sacral nerves and your middle cluneal nerves, all which are going between that foramen and the SI joint, which if they get exposure to local anesthetic, the patient will leave feeling better. So,
Absolutely. And I don't know how the insurance is covering right now, but can you inject the joint and the lateral branch nerves of the sacrum? Or do you have to stick to one or
on
the
the
other
same
for,
day?
yeah.
No. We have, don't get me started. We have such a messed up healthcare system that you can do one thing for one patient. And if you bill more than one injection um, for one patient. You're a pig. You're a criminal. You're doing fraud.
Yeah.
It's disgusting. I remember when I first finished training, you could do an epidural with a facet joint on the same day, and some people would pay for that. Of course, some people abuse that, but guess what? These problems coexist.
Mm-hmm.
You could have a
100%.
radiculopathy and an osteoarthritis of the facet joints. They often coexist. And it's disgusting how I have to tell patients, yeah, well, if you want the second shot today, you're not going to cover it, so you have to pay for it. But if you come back next week or after the follow-up just to talk about today and you
Mm-hmm.
suffer for a couple more weeks, then maybe they'll let me do it. Where
Right. And now you're sensitizing the pain pathway all while you're there.
that's right. So the system in the payer system is not set up in the best interest of the patients, nor the physicians, nor
Yeah.
society. I mean, if the insurance companies are making billions of dollars and patients are still in pain and we still have poor health compared to other countries, there's a problem here.
Right. Right. Our health span is terrible, and we have lots of money here to make people well and build the foundations of health, help people get well sooner. And yeah, it's really sad what we've made. But I mean, wonderful physicians out there trying and going outside the box, which I think is where you and I are, which is a great place to be. We can sleep at night.
That's right. That's right. It's not like cardiology where I think, or I mean, I'm not a cardiologist, but I'm just using that as an example where, this study shows you need to use this drug and that's it.
Mm.
Pain is
Yeah,
like kind of like well, I call anesthesia like bartending. There's a lot of ways to get you there. We could just, but pain management is an art form. It's not always the same path for everyone.
yeah, absolutely.
Anyway, I got to wrap it up and see patients. I'm sure you do as well.
Yes.
Thank you for joining us. Any closing remarks or anything you want to say before I wrap it up?
All I would say, if anyone's listening and they haven't tried regenerative medicine or orthobiologics and they do have a chronic pain issue, it is oftentimes a game changer and a lifesaver. And it has been for me, myself. I have two ACL tears and have been managing that since I graduated. So I would look into it, talk to your, local expert, and don't just go to any shot jockey.
100%. Make sure you know who you're seeing, that they have experience, and that they're also, going to advocate for you and work in your best interest.
Yeah, absolutely. Thank
Thank
you
you,
so much
Sarah.
for having me.
Yeah, thank you for joining us. I'm going to have Sarah's contact information in case you're looking for a naturopathic doctor in Arizona and or just want some more information. Have a great day and hope to see you guys at the workshops, courses, or conferences. Take care.
Thank you.